More than 6 million Canadians say that they do not have regular access to a family doctor. In response to this growing problem, Ottawa has announced a series of measures aimed at helping fix the problem, including more money for medical residencies and recognizing doctors who are trained abroad. But even with those efforts, in provinces like Ontario, doctors are retiring en masse. According to those same reports, 1.7 million Ontarians have a family doctor over the age of 65, which leaves many residents just a few short years away from having to find a new family doctor. Joining us now to discuss the shortage of family doctors in Canada is Dr. Abhishek Raut, Medical Director at Appletree Medical Group. Dr. Raut, thank you so much for joining us.
Great to be here, Theresa.
We know that there is a shortage of family doctors, but can you explain why this is such an issue for patients, and what are the consequences of this shortage, and does this amount to a bad outcome for patients?
Right. So we're in a situation now that more than 1 in 5 Canadian adults don't have a family doctor. And what does that mean from a patient perspective? Well, it means delayed diagnoses and treatments, which is particularly concerning when we deal with cancer. This means increased stress and anxiety for these patients who don't have a regular doctor. It means an inadequacy of access to care. So without a family doctor, patients are going to emergency rooms for their healthcare needs. And certainly it is resulting and will result in worsening health outcomes. On a macro level, what we are seeing is an increase in healthcare costs because of this, and also greater inequity in healthcare access. So this shortage is exacerbating health inequities in vulnerable populations, such as the elderly and those living in rural areas and low-income individuals particularly.
Now, in terms of why there is a shortage, some have pointed out that many Canadian doctors often end up leaving Canada and working in the United States. Why does Canada experience this brain drain of doctors?
Right, to answer that, really, we've got to go back to Economics 101. So what causes shortages? And there's only 3 real reasons for any shortage. One is an increase in demand. So if there's a greater need for something, such as turning on the AC on a hot day. The other is a decrease in supply. So people might be leaving the profession, for instance, or we're seeing issues with crops, for instance. And then the third is government intervention. So if the government imposes a price upon an item, typically that will lead to a shortage. So what do we have for family medicine in those 3 things? Well, unfortunately, we have all 3. We have supply and demand imbalances. Fewer medical school graduates are choosing family medicine because of poorer wages and rising expectations and burnout. We're having economic instability where family doctors can't really sustain a practice anymore. And this, of course, is leading to what you alluded to earlier, which is earlier retirement. And of course, we're seeing a lot of workload and burnout issues that are happening due to the greater expectations of family doctors. And most importantly, I think, is an inadequate investment. So there's not enough investment in primary care, including family practices. So this causes doctors to make difficult choices on whether they can sustain their practice. United States, of course, offers a higher compensation, greater autonomy, and maybe even attractive tax structures. So unfortunately, we end up losing thousands of doctors to the United States and other countries.
And what do you think could be done to help those doctors in Canada, or those doctors stay in Canada?
Right, to stay in Canada, I think we'd have to look at improving compensation and benefits, really offering some competitive salaries and benefits that could make Canada a bit more attractive for family doctors. Most family doctors do not have sick benefits, and most family doctors do not have retirement plans. So because of that, we are seeing that brain drain away. Now, having said that, there have been some good news as well. British Columbia, for instance, has made some great progress by supporting family physicians with their administrative costs and workload. And from what we can see so far, I think the model is working very well. So I think a lot of the other provinces have a lot to learn from British Columbia.
And one potential solution proposed is recognizing the medical credentials of doctors who are trained abroad. Do you think that this is a viable solution to help solve the shortage? And what are the potential issues with recognizing foreign trained doctors?
I think that's a very good question. I think recognizing foreign trained doctors can be a band-aid or temporary solution, but inevitably we go back to those fundamentals of shortages. And as long as we don't correct those 3 points, I think what we may find is foreign trained doctors will come to us and then may end up leaving again. Of course, there's also concerns about quality assurance and residency challenges as well.
Thank you so much for joining us today.
Thanks so much for having me.
Coming up next, Conservatives once again try to oust House Speaker Greg Fergus. And more politicians are being banned from Pride events, this time in Alberta. We'll have those stories and more news from around the world coming up after the break.